Welcome to Health IQ. I'm Dr. Alan Siegel, your host. Today we have a very special guest, Dr. David Cuccia. Dr. Cuccia is a chiropractor and the inventor and founder of the ExtenTrac Elite. Welcome, Dr. Cuccia. Thanks for coming here.
Thanks for having me, Dr. Allen.
So tell us about this device that you've invented over 20, 30 years, and what kind of brought about this invention?
Well, it's thanks for having me to your show. Appreciate being invited here. About 30 years ago, I don't look that old, or that experienced. I was confronted with a patient who was bent at a 30-degree angle, sciatica down her right leg. She was a nurse. She had hospital traction. She had medicine, medical drugs. She was disabled. And she happened to be related to my sister's husband.
Okay.
And so she came in, we referred in for some chiropractic care, which only gave palliative care. Didn't do anything to help her disc condition. She had 3 herniated discs.
Okay, so she had herniated discs.
And it was causing pressure on the nerve root, that's correct. Right. And it was shooting down the right leg. And she had the very common antalgia, where some patients or some people who are watching this might relate to very easily when they, as you know as a doctor.
Well, tell them what is antalgia. Demonstrate so people understand what that is.
Antalgia is when you have back pain or leg pain, and the spine shifts, and it moves the patient away from their pain.
Right. And I think anyone watching that has had back problems can understand that position.
Yeah, they look in the mirror, and they see their hip here and their shoulders there.
Yeah.
And it's the body's wisdom to move the spine out of pain. And so, 30 years ago, it was a no-no to think of putting a patient into extension, which is bending the spine backwards, in a backward position, backwards. And we had done every adjustment that was possible. That's a manipulation of the spine. We had done physical therapy, physical therapeutics, ultrasound, diathermy. It was useless. She was still bent at a 30-degree angle. She was in pain. And I don't like to fail on anything I do.
Right.
And that's what led me in this quest at the Holy Grail. Now, the doctor in Canada who has now a machine 30 years later says there's no miracles, but this is the closest thing to it.
Well,
Usually he's a physiatrist, medical doctor using it in Montreal. Wonderful, wonderful healing doctor. Works in an amputation hospital.
So you're motivated by failure, essentially. You wanted to help your patients.
So I wasn't going to lose this patient. Right. I wasn't going to lose only because of, not because I didn't want to lose economically. I didn't want to fail. Believe it or not, doctors, as you know, they really want to help their patients.
Sure.
And this doctor here was failing.
Right.
So I said, you know what? I got to separate those vertebrae as quickly as I can, and as forcefully as I can without hurting the patient. So I basically put my back against her back. I picked her up in extension, backwards. All of the text and the literature and the evidence-based are all the flexion, knees up, pillows under the knees and all this. Here I'm doing a completely opposite concept. I'm going to pick her up and dynamically lift her, let the legs drop, and put her in extension, bend that spine backwards.
So the basic concept was extension. That's what drove you to...
Basic concept was ExtenTrac, and therefore, as soon as I put her down from that bending backward position with a combination of traction and dynamic lifting, she came down. All of a sudden, she was moving her leg, and instead of being 30-degree listed like a boat taking on water to the side, she was standing straight.
Because that biomechanical maneuver essentially released pressure probably on her nerves.
And we realize now from studies now that I'm sure you've seen also that based on the work of Dr. McKenzie in New Zealand,
protocol, he incorporates a lot of extension.
Almost concomitantly with my findings, is that when you bend backwards in a backward position, and that's what's used now currently for some exercises to help bring a disc that's herniated usually towards the back because the patient's lifting something up, and the disc collapses in the front, shoots the nucleus, the soft center of the disc backward against the outer core, and it pushes backwards. So here you're lifting, creating a space, closing the back, and driving that extruded disc material to a forward direction towards the umbilicus.
Okay, so you're helping actually move the disc material back into place to some degree.
We're shifting, using the body mechanics to shift it. That's correct. And so with her, she had completely no pain. She was out of pain. Practically with the first maneuver.
Right.
I had 4 months
and this was a manual maneuver, but I think if I'm
for 2 years.
Yeah, Because after a while, doing this, manually,
so then you
can be
decide
very
to develop
taxing
more
on the
of an
doctor.
automated system
that is the ExtenTrac. And how is that different from traction or spinal decompression exactly?
Well, spinal decompression is really a new concept that's been out, and it's really describes the phenomenon that happens inside the disc to a body's response to a longitudinal long axis pull. Now, the work of Ramos and Martin out of the Rio Grande Hospital with the VAX-D, they put an intradiscal catheter in there, and they showed that there was a precipitous drop in the disc pressure. Now, how that relates to healing, we're not sure. But the concept that applies to any kind of long axis stretching, no matter what device you use, you're going to be dropping that internal disc pressure. And when you do so, you create a negative pressure, and they call it a decompression of structures that are under compression. Most of the weight of the body falls through L4.
Like a vacuum effect? Is that the best way to describe
Maybe
this? We have a spine. Yeah, we have a spine. Let's demonstrate.
I see it over here in
show.
the corner of my eye.
This way you can show our viewers.
L4 and L5 is where the weight of the body falls through L4 and L5 and on the discs. The L4 disc and the L5 disc.
Okay.
Now, all of the structures in the spine, including the disc, are pain sensitive. And they're impregnated with thousands and thousands of filaments and nerves. Even the cartilage in between the facet joints filled with nerves. And there's connections between the major nerve trunks that exit between the vertebrae.
So any pressure on those nerve structures would cause pain.
Standing, working, flexing, where the disc pushes back. It can push out that disc. Here's an example of the disc being pushed out, and it can strike the nerve. Yeah. Here's the nerve.
And you can see that disc, it moves, so it shows that they can herniate in various ways in various sides and anterior and posterior.
Now, if I may say, in the terms of Sharon, had I bent her forward, I would compress the front of the disc and push that disc out more.
Right, if it was more anterior based.
Yes.
Yeah, okay.
So here I bent her backwards and applied simultaneous distractive forces to decompress, lower the internal pressure, and that disc gets sucked back in as you're elongating the structures and removing pressures on all of the joints that are pain sensitive and pain generating, all the pain receptors.
And what's interesting, even as you're moving the spine around, there's a three-dimensional component to the way you're moving the spine and the way our spines move.
Right.
So you're talking about long axis traction.
That's exactly correct. And so your treatment should be. The spine is three-dimensional, and so should your treatment. So in the case of some patients with the ExtenTrac, the doctor should first analyze. It's not just the machine, it's the protocol analysis goes with the machine. Yeah. And it's based upon evidence-based research. Some patients, based upon their MRI, may need flexion to drive the disc in the right direction, away from the nerve root or from itself. Other patients respond, like Sharon, need bending backwards. Extension. Yeah. Right. And so you do a provocative testing with the patient before you treat the patient.
So you may have the patient bend forward or bend backwards, bend to their sides.
Exactly.
What causes the pain? Where is the pain coming from? What direction causes the pain? And the direction would help you dictate how to treat.
And you do the opposite from the pain-producing direction. Right. So you're actually going to mimic that antalgia that the patient comes in. So in the acute, recent onset patient with severe back pain, leg pain, and a spine that's twisted like this, you don't seek you can't pull them straight, first of all. If you put them on a traditional, you asked what's the difference between ExtenTrac and traditional traction or decompression.
Yeah.
The ExtenTrac is 3D. It's three-dimensional.
Three-dimensional.
Where you can position that patient.
As our spine is, like we mentioned. Yeah.
So instead of pulling the patient, every patient comes in the same way, everyone's different. Instead of pulling in the same way, each patient is put into that position that mimics the pain relief that you've heard chiropractors say, innate intelligence.
Right, our body tells us which way to lean because we want to get away from pain.
Correct, and you observe the patient from seeing visually.
Right. And
then the MRI results. You put all this together and you say, you know what? We'll correct the chronic problems secondary. Let's get the patient out of pain as quick as we can. Quickest way to do it is to mimic the patient's pain relieving position. If we don't see any obvious changes on MRI, things from the patient from examination, then we go to our evidence-based knowledge of the literature, what's available in the literature, what positions for that age group of patient. Is there degenerative changes in the spine? Is there stenosis?
Yeah, there's a lot of factors that go into how to treat them. And so the ExtenTrac therapeutic device, so I understand, I think we're going to take a look at this in a little bit, there's multiple protocols. It's not just every
Right.
patient, regardless of condition, gets the same treatment. People
Right.
will get
a very good. It's a very important point.
Yeah.
If I may, amplify what you're saying. A patient who was on ExtenTrac said he had gone under some sessions on a linear table, posed linearly, straight, without three-dimensional positioning first, prior to the application of distractive forces, the pulling forces, and basically, there's no clinical decision made. It's lay down and let's hope it works.
Right, because they're not modifying it based on the condition. It's just the same treatment for every patient.
It's not medicine.
Yeah. It doesn't make sense, because if you equivocate that to a surgeon, no surgeon would go in and always perform exactly the same procedure if the condition's different on different patients. So
Absolutely.
it doesn't make sense. So the ability to have multiple protocols.
Right. And that's what's important the very first, second, third, fourth visit. If the doctor doesn't position that patient into the intelligent position that the patient presents, or based on the evidence-based and the patient's MRIs, and makes changes to the position of the patient platform that the patient lays on and the spine conforms to, and you begin the axial gentle distractive forces, you can actually drive a disc into a nerve root.
Yeah, so you have
and
to
injure the patient.
Yeah, which would make
so
them worse,
it's
obviously.
critically,
We don't want to do that.
you're not going to get the results that you would get what we see with ExtenTrac. And I'm happy to say that.
Well, that's a good point you bring up, because patients, they're in pain, and we've both seen this in our careers, and they don't want to be even touched sometimes. How do we get them to get into a subtle distractive position, gravity, sometimes just gravity. How do we use gravity, and have you incorporated that subtle use of gravity into these protocols? Because a full distraction may scare people. They're not ready for that yet. So
their spine's not ready for it. That's correct.
And their body's not ready. So what can we do?
So there's intermediary steps before you just take everybody and treat them like they're subacute. Subacute means you've got 50% correction. They've gone to, pain is reduced 50%. They have function, neurological function improved. So you don't treat every patient as if they're subacute. When the patient comes in and they have full fulminant pain. I had a patient this week who came in to see me, who wears a security guard in the hospital. He had such swelling around his L5 nerve root that they thought it might have even been a tumor. And the first thing that I said is, did they give you any anti-inflammatories? And even though I practice a drugless healing art, it doesn't mean I don't recognize the benefit of proper medical
sure. You need to integrate
pharmacology.
all modes of healing sometimes.
So the first thing I said, you got to get an anti-inflammatory. You're too inflamed. And then we began gentle gravitational, using the patient's natural body weight and three-dimensional positioning.
Right.
And the first 2 or 3 times, take it very easy. You don't put every patient on their back or on their stomach. Right. And that's the flexibility of ExtenTrac, because 50% of the patients will get well on their stomach, 50% will get well on their back.
Right.
And then 50% will get better axially, 50% get better three-dimensionally. So you have the versatility to mix and match and to change your treatment based upon the patient's presentation and changing an evolution of his symptoms. Right. So now within 8 to 10 visits, the patient's
and the protocol may
out
change.
of pain.
And the protocols could change.
Exactly
right?
the point.
Yeah. So, all right. So we have some video here of this device. I think it's an outstanding device. I've never seen anything like it, quite honestly. And the multiple purpose and multiple therapeutic procedures that can be performed on one device is quite unique. So let's take a look at this, and we're going to describe this to our viewers as we're watching it. So this is the ExtenTrac Elite.